歡迎大家嚟。
Welcome to today's press briefing. We have with us from the CHP head of the Communicable Disease Branch, Dr. Chang Shuk Kwan, and from the Hospital Authority Chief Manager, Dr. Sarah Ho. We'll first hear from Dr. Chang. Good afternoon. We have 120 confirmed cases, numbered 13911 to 14030. And about 34 of them are imported cases. Of these cases, over 20 of them are RB405 arriving on the 1st of 25th. They are picked up when they've arrived. 86 cases are local cases. Of the 86 local cases, 75 of them are related to other cases. They are 2 cases that might be related to imported cases. The 2 cases are people working at the airport. One distributing clean vials to those arriving in Hong Kong waiting to be tested, taking them to their seats and maintaining order. That person's subjected to testing every other day. On the 27th is positive and on the 25th is negative. And that person lives in Kim Si Fa Yuan Golden Glory Court. It's a 24-year-old male and is in charge of cleaning, living in Ching Yat House, Yat Tong Estate, cleaning toilets in areas where arrivals would go there to wait. We will conduct genome sequencing analysis to see if they're related to imported cases. In relation to Kwai Ting area, in the 75 cases, a lot of them are related to Kwai Chung Estate. The latest figure for Kwai Chung Estate, well, there was a lockdown testing last night. We've only identified 1 case in Ha Kwai House. Let me give you some figures. Yat Kwai House, no new cases altogether. Well, no new units, but new cases, because the cases are picked up from quarantine centers. 274 cases in total, 133 units. Ying Kwai House. Well, I was talking about Yat Kwai House. For Ying Kwai House, 92 cases, 47 units. Nga Kwai House, 12 cases, 7 units. Ha Kwai House, 16 cases, 6 units. Chin Kwai House, the same, no additional cases. That is, 3 cases, 2 units. Yok Kwai House, 3 cases, 3 units. Hiu Kwai House, 4 cases, 2 units. Choi Kwai House, 3 cases, 2 units. Lok Kwai House, 1 case, 1 unit. Big Kwai House, 1 unit, 1 case. Chun Kwai House, 5 units, 4 cases. Park Kwai House, 1 unit, 1 case. Chow Kwai House, 1 unit, 1 case. Altogether, 416 cases involving 210 units. For the other related cases, we have identified some transmission in a localized area. In the Collinson Hill Crematorium, there is a case working there. It might be related to a previous case living in Chung Po House, who is a cleaner. Between the 21st and the 27th, for those who have stayed for longer than 1 hour at Cape Collinson Crematorium, they have to get tested. And there is Hong Kong TA, the Yun Yun Institute number 3 secondary school. There are a few more students, 4 more students. 1B, class is 1B, 5C, 1B, 1C, 5C, 5D. And in Far East Financial Center, floor UG, there is a place called Hong Kong Day. Is someone working at the bar. 2 of them, they are confirmed cases. There's one before who lives in Cheongpo House. There is also an additional case on the 16th of January, visited Little Boss in Mongkok, 187 Tung Choi Street. It's now a confirmed case. That person just stayed at the shop without buying any hamsters. Previously, we have obtained environmental samples from the 30 or so shops. From this shop, we have obtained some positive cases. 34 samples obtained, 6 of them are positive. This person also carries L452R. We've also received cases who have been coastal skyline in that rotunda area, people who have played there. Apart from the cases related to other cases or imported cases, there are also 11 cases that are currently unlinked. 2 of them are suspected to be Delta cases because they have L452R. One living in Sun Kwong Center, Block 2, a case identified via sewage monitoring program. The other one, living in Kwun Tong, Samuel Ping, Lai Tat House on Tat Estate, who works in Choi Wan Estate shopping mall as a cleaner. The other 8 cases are suspected Omicron. There is one unclassified because the viral load is low. For the 8 cases, they live in Tam Kong Road, Wen Tin Building. Block C, New Kwai Fong's Gardens, but they are different units and with a different floor and a different direction. There is also one in Phase 1, Block 13, Laguna City. There is one in Shang Lai House, Shang Tak Estate, and also Tin Shui Wai, Chun Wang Hin, and To Kwa Wan. There is also one Yam Yu House, Shek Yam Tong Estate, and also one in Sha Tin, Tower 3 Vista Paradiso. There is one case lives in Feng Yi Street 21. We've been to the shopping mall in Lions Rise in that restaurant. We identified that for the 2 tables, they are set close to. They are not close together, but they checked out at about 9:14 when they paid their bill. So there is a chance that they walk past each other when they pay the bill. We'll now hear from Dr. Ho about the hospital authority situation. As at 9 a.m. in the previous 24 hours, we have submitted 140 cases, reported 140 cases. 20 patients in the previous 24 hours have recovered and discharged. So far, 12,730 patients have been discharged. We have 891 patients staying in the North Lantau Hospital Hong Kong Infection Control Center, the community treatment facilities at Asia World Expo, and 12 public hospitals. All of them are in a stable condition. The number of admissions has spiked recently. Today, the HA has reopened Hall 9 and 11 of Asia World Expo. Together with halls number 8 and 10, we have 1,000 beds at the community treatment facilities. We will focus on those who are in a stable condition or those who are recovering. In this way, the Infection Control Center and capacity as well as public hospitals can release beds to admit new admissions and those who are in need. We will closely monitor the situation. If need be, we will further increase the number of beds in the community treatment facilities. There are more and more admissions. We need manpower. I now make an appeal to those who are healthcare workers, especially those who have retired from HA or those who work in the private sector who have retired. Please make yourself available and join our team to fight against the epidemic. Healthcare workers can make use of our special scheme to help us. We will provide suitable training on infection control. Will also provide personal protective equipment. I'd like to report a case to you. It's a 73-year-old female. Because she had a dry cough, she went to the outpatient clinic at a hospital, and it came back that it's a case of preliminary positive. Our infection control unit immediately started contact tracing. We found that one doctor did not wear eye goggles when examining the throat of the patient, so the doctor is classified as a close contact. We've arranged for PCR test and the result is negative. We will wait for further examination result. We have conducted thorough disinfection and cleaning at the outpatient unit. We will enhance our facilities. We now remind our staff members that if patients need to remove their mask or if there is a high-risk procedure involved, then they have to don proper personal protective equipment. The hospital is Our Lady of Marino Hospital.
We now have a Q&A session. Please identify your organization before you put your questions. The gentleman over there. Good afternoon. I'm from Now. I want to follow up on the cases at Kwai Chung Estate. The three buildings under lockdown have now been completed. And now we have three at Ha Kwai House. We have three more cases. How do you assess the risk of transmission? Have you able to really block the transmission? And also on the question of Delta cases, I want to talk about Cape Coliston Crematorium and also the bar worker at the Far East Financial Center. Are they all Delta cases? We have two more untraceable cases, unlinked cases related to Delta. Are you saying that we have a new trend of Delta transmission? And are they even more serious than the Omicron cases? Yes, we have new cases, but most of those cases were detected among the close contacts at the quarantine center. Only we have got a new case at Ha Kwai House. So far we have 6 units affected. For the 3 blocks, the major transmission chains have now been put to a stop. But we cannot be complacent. There may be some contamination in the environment and people may continue to use the same common facilities, so there's still some risk of transmission. We cannot rule out further cases in the future, but that would not be as serious as the major outbreak that we saw. So the operational objectives have been achieved. But of course, in the community, there are other cases in other buildings. Kwai Chung Estate residents would continue to be monitored. They will be tested. They have to hand back their testing kits for checking because the incubation period has not been completed. For the Cape Coliston case, it's a L452R variant. Chang Kong, Ho Yun, Choi Wan, Chung Po House, and the Sunbeam Center and Choi Wan Estate. All of these cases are related to L452R. Other cases are Omicron cases. So actually there are two major transmission chains which are ongoing, but we don't know how many minor or smaller chains, transmission chains there are. We will be monitoring the situation closely. The one at the back, I'm from cable TV. As for the cleaning worker in Sao Ping, what is it related to the one in Chi Ching? As for the coastal skyline cases, how many are there? How many new cases have you received? Are they all related to close contacts? We have not identified a clear link, although those cases all visited Choi Wan Commercial Center. So we would ask all of them to be tested to see if there's any link. If you say that they just passed by one another and got infected, then tracing would be more difficult. As for the Skyline Circle cases, according to the information received, there's a place, a circular plaza, where people would play football, and young people would play or have soccer games there. There are many kids there. It would be difficult to trace each and every one of them because they don't really know each other. Some of them may remember that some other people were there at the relevant time. So we will ask them whether they know any friends who had been there. But we don't know how many people did visit the place in question. We are not very sure. The lady at the back, on the right, the middle row. I'm from Oriental Daily. How many preliminary cases have we got today? How many of them are unlinked cases? As for, we have 11 unlinked cases. Are they students or retirees? Did any of them conduct risky operations? And how many cases? There are a number of cases involving Chongpo House residents or visitors there. Is it premature to cancel the lockdown at Chongpo House? Are you not concerned that that may lead to a community outbreak down the road in respect of Chongpo House cases? We have 70 odd preliminary cases so far. For the 11 cases you have mentioned, some of them are related, are students as young as 6 years old. Some are older kids, and some adults. One is a primary pupil. That student didn't go to school after the 13th of January. As for Chongpo House, they are all linked to other previously confirmed cases. So canceling the lockdown would not lead to more infections. Because we are talking about cases which were exposed before the lockdown. After the lockdown of Chongpo House, we have not detected any new cases there. Good afternoon, I'm from Mingpao. We have a complaint today related to a allegedly false positive cases. One case number 13088. The 17-year-old boy said his father was classified unconfirmed, and then the baby was subsequently found not to have any antibody. But then the father was classified as a asymptomatic case. So why did you classify the bay as a asymptomatic case, maybe it's just a false positive case, would you cancel that case classification for the baby? One for the father of 13088, a close contact, the family said that the CHB asked them that they can have a household quarantine. The mother would be able to leave by the 2nd if they tested one more time negative. So why is it allowed to go home for quarantine before the expiry of the 14-day period? And then there's unlinked cases, a number of Delta cases such as 130848, a retiree, a woman in his 70, 13757, 18-year-old female, and 13370, washer, hair salon worker, and also a third question. And the elderly center has been reported to got a confirmed case in Yau Tong. What's the case number? How many people have to be tested arising from this case? And for the 2 schools with outbreaks yesterday, such as Yun Yun Institute, number 3 secondary school, how many cases are there for that school?
Just now you talk about 13088. As far as I know, well, we are aware of the incident. There are 5 in the family, 2 confirmed cases. The remaining 3 are close contacts, and they've been sent to quarantine centers for 14 days. For the tests, 2 of them are unsure, and the baby was tested positive in our public laboratory. For the father, it's negative, so it's slightly different. When they're admitted, the father is not a case, but the baby has to be accompanied. So the father accompanied the baby at the hospital. The mother is not a confirmed case. So the mom stays at the quarantine center. All tests are negative. The baby is tested positive, so it's given a case number. Upon admission, there were a few other tests. They've been negative, and for blood tests, it's also a negative, so there is no antibody. But there has been previous cases when antibodies were not identified. We've discussed with the doctor, and we've conducted some analysis. Now we've classified it as a unconfirmed case. That case has been staying at the hospital for a number of days. So the baby meets the criteria for discharge. The father is a close contact. So in theory, the father should be staying for 14 days, that is the 1st of February. We know that the family is under great pressure because they have 2 confirmed cases in the family. So we make special arrangements for them to be discharged by 1 or 2 days from the hospital. The baby and the father are negative all along, so it's rather low in terms of risk of transmission. You talk about a case involving a residential care home. You're talking about a staff member? I don't remember the name. I remember that there is a staff member who's been tested positive and become a confirmed case in a quarantine center. For the other one is the date is actually 5 to 6 days before, so it's not within the incubation period, so the residents at the care home do not have to be quarantined. For the cases you've mentioned, For the time being, no confirmed source has been identified. We don't know how many transmission chains there are in the community. Next question. The lady in white on the right. I'm from TVB. First, I'd like to ask about Delta cases. You mentioned that there are 2 Delta cases. So apart from these 2, have you identified any suspected and yet to be confirmed Delta cases? Starting from next Saturday, those arriving to Hong Kong will go through a quarantine period of 14 days instead of 21, and for the remaining 7 days they will have to stay home for self-monitoring. For some Omicron cases, the onset starts between the 14th to the 19th day. Is there any risk of any cases escaping your monitoring mechanism? We know that the Omicron cases has yet to peak. Is there tremendous pressure faced by the healthcare sector? Is it on the brink of collapse? We see that there has been an increase of 400 cases of nursing staff. Is that enough? I don't really understand your question. For L452R, then it's a suspected Delta case. If it's N501Y plus T478K is Omicron. So there are no cases that is suspected to be Delta but not Delta. Currently, there are 11 cases that are unlinked. Well, actually 2 of them. But for today's cases, there are more than 2. Because for residents at Chung Po House and those who've been to Little Boss, we can find the link. Say Hong Kong, the case at Hong Kong Day and the case at Cape Collinson. These are related cases and they are suspected Delta cases. 14 plus 7 quarantine period. As the chief executive has already explained it. We just want to align it with the arrangement for close contacts in Hong Kong. There are currently 200 nurses that have been deployed to the North Lantau Hong Kong Infection Control Center and the community treatment facilities at AWE. We want to make use of a special scheme to hire about 400 part-time nurses and doctors. For the additional facilities we have commissioned, we need healthcare workers to man them. I'd like to take the opportunity to thank our colleagues. They have been working very hard, and within a very short time they increased the capacity by a few hundreds of beds to cater for the sharp increase in admissions. We'll closely monitor the situation of the epidemic. If need be, if the situation goes to critical, then we may need to reduce essential services. But we will reduce the service of non-essential service. We'll closely monitor the situation. Now, the gentleman at the front. I'm from Hong Kong 01. I'd like to ask, there is a preliminary positive case. It's a Bank of China in Tuen Mun Town Plaza. It's manager of customer relations. Where does that person live? We know that that person still goes to work today. So those who have been to that branch of the bank, do they have to be tested under the compulsory testing notice? For lockdown cases, and previously, if there is any unlinked case or if it involves a variant, that will be locked down. But we noticed that for some buildings with confirmed cases, they have not been locked down yet. So has there been any change in the arrangement? What is the criteria? Is it the case that you don't have sufficient manpower to do that? When there are some buildings that have to go through lockdown and some not, how do you assess the risk transmission?
We have more than 100 cases. These people work in different fields, banks, restaurants, construction sites, and other places. So I won't comment on individual cases. But if we think that the particular location is risky, then we will have to consider whether we should put those visitors to compulsory testing. But we have more than 100 cases. So we cannot really ask everyone to undergo the compulsory testing. So we concentrate on riskier cases. As for lockdowns, the relevant departments may consider the factors that you have mentioned. Other questions? The front row on the right.
How many cases are now involved in the pet shop cluster in total now? Have the outbreak reached its peak yet based on its current situation? And how many Delta-related chain of transmission are there right now? Thank you.
I may not have the exact figure for the because the Delta-related cases, they are linked to quite a number of cases, including those in the buildings as well. So it's very difficult to count the total number of cases. It's more than 20, 30, or 40 cases. Yeah. I think that we have quite a number of unlinked cases in the community, so we cannot estimate how many undiagnosed or undetected cases in the community are due to Delta. I can only tell you what we observe among those confirmed cases. Some of them are working or living in Choi Wan or Chambola or in the Ho Yun, and those places we observe there are Delta and also Wang Dai Sin. And for the other cases, they are related to the Kwai Chung estate, and their transmission chains, they mainly related to Omicron.
仲有冇其他問題？記者會結束啦，多謝大家。
That's the end of the press briefing. Thank you.